The idea for insulin first came to a Dr. Frederick Banting in the wee hours of the morning of October 31st, 1920. An orthopedic surgeon and part-time professor at the University of Western Ontario, Banting had come across an article on the pancreas while he was preparing for one of his lectures. This article suggested that diabetes resulted from a lack of a hormone that was secreted by the islets of Langerhans in the pancreas, the hormone being coined insulin. But attempts to supply the missing insulin by feeding patients with fresh pancreas or extracts of it had thus far failed. And this was presumed to be because insulin was being destroyed by the enzyme trypsin, which was being produced by another part of the pancreas. The problem, therefore, was how to extract insulin from the pancreas before it had been destroyed. Waking up from a fitful sleep on that night of October 31st, 1920, Banting scribbled down a 25-word hypothesis that, within the span of a year, would lead to one of the most significant medical discoveries of the 20th century. Banting had the idea that ligation of the pancreatic duct would destroy the cells that secrete trypsin, while at the same time avoiding destruction of the insulin-producing cells, thus leaving islet cells intact so that they could be potentially used for treatment of diabetes. Now, Banting was intent on investigating this possibility, but with little research lab experience himself, he then approached John McLeod, who was a professor of physiology at the University of Toronto, with his idea. Now, Dr. McLeod was intrigued and decided to give him his facilities for experimental work. He also appointed a medical student, Dr. Charles Best, to work with Banting as his assistant. So, in the summer of 1921, Banting and Best got to work ligating pancreatic ducts and extracting islet cells from dogs. By the end of July, they had already injected their first pancreatic extract into a diabetic dog. And to their amazement, they observed a sharp drop in its blood sugar. So they knew they were onto something, but they didn't know whether these extracts were ready for humans. So they then brought on biochemist James Collip to help them refine and improve the purity of the extracts so that it could be fit for humans. And by January of 1922, which was only a very short time window, the Toronto group already decided that they could safely begin testing their pancreatic extracts on human subjects. A discovery was thus born. And thereafter, diabetes clinics were established in Toronto that enabled thousands of people with diabetes to come and receive life-saving insulin.
I think the importance of Banting House National Historic Site of Canada is represented through its symbolism. For the global diabetes community, Banting House has become a symbol of hope, comfort, and ingenuity. We can't underestimate the importance of symbols. They represent who we are and where we're going. 100 years after the discovery of insulin, we have better insulin. What we don't have is anything better than insulin. And that's why people from around the world come here to this very room to stand where Banting came up with that life-saving idea. They come here to write a letter, a personal note of thanks to Sir Frederick and the rest of the team for a discovery that's impacted their lives and continues to impact the lives of millions. It's been 100 years since the discovery of insulin. We don't have another 100 years to wait. Banting House reminds us of that. The story of Leonard Thompson is a fascinating one. He was the first individual to successfully be treated with insulin. He was admitted to Toronto General Hospital on December 2nd, 1921. On the Allen diet, the starvation diet, which was the only method to treat diabetes at the time, he was 13 years old, he weighed 65 pounds, and his daily calorie intake was 450. As the race to purify insulin intensified, on January 11th, 1922, he's given a form of the extract developed by Banting and Best. While this test showed limited success, there was no real clinical value to it. 2 weeks later, on January 23rd, 1922, Collip's more purified version of the extract was tested on Leonard. We had complete success. His death sentence had been lifted. Leonard would go on to live another 13 years before he passed away at the age of 27 from pneumonia and diabetes complications.
We have come a long way from that miraculous discovery that would save the lives of millions. We now have insulin formulations that can control glucose levels for 24 hours with just one injection. We have insulin infusion pumps that are programmed to deliver insulin at different rates throughout the day. And we have sensors that continually measure glucose levels without the need to prick one's fingers or check our urine. We now even have hybrid closed loop systems that actually integrate information from glucose sensors with insulin infusion pumps so that insulin infusion can be continually adjusted based on both current and predicted glucose levels, thereby almost mimicking a real pancreas. We also now have treatments for type 2 diabetes that can control glucose without risk of hypoglycemia, and some have added benefits of weight loss and protection against heart and kidney disease. These amazing advances in diabetes management have led to significant reductions in diabetic complications, as well as improvement in quality of life for people with diabetes. But diabetes, unfortunately, still poses a tremendous burden on individuals, families, and healthcare systems. Therefore, the future of diabetes management will need to focus on treatments that target the root causes of diabetes and can induce remission or even reversal of the condition rather than just glucose control. And ultimately, we need to find ways to prevent diabetes from developing in the first place, both type 1 and type 2 diabetes. Now, with almost 1 in 3 Canadians now having diabetes or prediabetes, we are facing an epidemic of diabetes, which has largely been attributed to a massive increase in cases of type 2 diabetes. And so we will be needing to also study healthcare delivery models that can better accommodate this growing number of people who require diabetes care, as well as the increasingly complex and multifaceted nature of the condition. But these numbers will only continue to grow, and they will threaten to overwhelm our system if we don't focus on prevention. Up to 40% of type 2 diabetes can be preventable with health behavior modification. And so we need to refocus our efforts on upstream interventions to improve health behaviors, as well as interventions that can optimize the conditions and environments in which people live so that it's easier for people to make healthy choices.